Hi YouTube. As I was preparing my other video in the series of labs that your doctor should check for but likely doesn't, I thought it was important to explain what preventative care is, to kind of give an idea as to why it is that there's so many labs and so many markers that most doctors don't check for or most doctors don't screen for. And it really comes down to what the notion of preventative care is and how physicians are trained. So the traditional definition of preventative care, as we hear it in politics and how we hear it in the media and how most doctors understand it, is basically how to prevent a disease from progressing. So, for example, you get a patient who has hypertension. Preventative treatment is treating that hypertension so that it doesn't develop into full-on cardiovascular disease and it does develop into a heart attack or stroke. In the case of diabetes, you diagnose someone who's pre-diabetic and you either treat them or give them advice before they go on to full-blown diabetes, or if they have diabetes, you treat them and try to control the diabetes to prevent them from developing the complications of diabetes, such as end-stage kidney disease or neuropathy resulting in lower extremity infections and amputations and things like that. When it comes to cancer, it's all about screening. So it's all about finding the cancer at an early enough stage to where it's still treatable, where it could be surgically removed, or it has a stronger chance of getting treated by chemotherapy and radiation. And COPD, when you get a patient with COPD, trying to prevent that disease from developing into chronic respiratory failure. And so what you're doing is you're still diagnosing a disease and treating it, trying to prevent it from getting worse. This is what preventative medicine is in the traditional sense. And I think it's arguable whether or not it works. Studies have shown that it's not really all that cost effective, meaning that it'll be maybe less expensive than treating the worsening condition, but it still costs a lot of money, and in a lot of cases really doesn't affect mortality, meaning you still have the patients dying of the condition. They're just maybe not dying sooner. You're basically just having the patient live longer with this disease than actually treating the disease or getting rid of it. So in my eyes, this is a failed system. And unfortunately, this is the way doctors are trained. One of the quotes I will always remember most throughout my training in medical school, which was said by the one doctor who taught us nutrition. He was actually a PhD, and we had a small nutrition class, but he said, doctors are taught everything there is to know about disease, but they are taught absolutely nothing about health and about good health. And that stuck with me, and he was absolutely right. So what preventative care actually is, or actually should be how to prevent the population from getting these diseases in the first place. What to look for in a patient who starts to show signs of developing this disease before it actually becomes a diagnosed disease. This is not taught in medical school. So I'm a doctor, I went to medical school. All of these things that I'm sharing with you and that I plan on sharing with you, I learned outside of medical school. I learned after I graduated, and you'd be very hard pressed to find doctors who do that kind of extra education to to be able to exercise this. So part of the problem with preventative care in politics and in traditional medicine is that we're looking at doctors who are trained in disease and only disease and how to treat disease on how to prevent people from getting disease, and they're the ones who define what traditional medicine or what preventional medicine is. And unfortunately, I think that's one of the reasons we failed. So one of the key things when it comes to disease prevention that again is not expressed at all is education, not medication. So educating the patient is probably the most effective tool that we have. Unfortunately, most doctors don't have the time to educate patients. When you spend 15 to 20 minutes with a patient on a routine follow-up visit, it's very difficult to educate them with enough information that it will trigger a change in their lifestyle or change in their habit. So it's something that's very difficult to do, and somehow, but we need to invest in that. And I think an important thing to consider as to why true prevention is so important is just to look at the blue zones, or to look at our centenarians. Okay, so for those of you who are unfamiliar with the concept of blue zones, it's the areas of the world where there tends to be a larger concentration of people living to their hundreds than in other parts of the world. There's been a science almost developed to study this and to study the concept of healthy aging and how do we get to be 100, and what are the features of these populations and these people that can tell us about health and disease prevention. And so one of the most important things to know about the centenarian population is that they actually die of the exact same diseases that the general population does. So it's not like these people have magical genes and that they mostly die either from car accidents or from falling or from just these unplanned or accidental events. They die from the same diseases that kills the majority of the population, which are cardiovascular disease, cancer, complications of Alzheimer's or Alzheimer's related diseases, and diseases related to diabetes or metabolism. So those are the four major killers of humans, and the centenarians, it's exactly the same. The other thing we know is that when these centenarians develop these conditions, they die at the same exact rate as people of the general population when they're also diagnosed with these conditions. So that's to say that once these diseases affect the centenarian population, or these people with good genes or good healthy aging, the severity of the disease isn't any less. So if that's the case, why is most of medicine, most of what doctors learn, most of what pharmaceutical companies investigate when it comes to medications, why are we only focusing on treating the disease and not preventing us from getting that disease, where then we could be closer to the centenarian population? So if you want to live a long and healthy life, the goal should not be to treat your disease once you have it, or to slow down your disease once you have it. No, the goal should be to prevent you from getting that disease. And again, most doctors are not trained in this. This is something that you have to find physicians or practitioners who have done extra education in this. So if you have any interest in this kind of stuff, please follow my channel, like the video if you enjoyed it, but hopefully through my channel and through my media that I'm going to produce, we can kind of figure a lot of this stuff out. So thanks for watching and take care.